Picture this. You're a cowboy in the 1870s. You've just been in a nasty saloon brawl, or maybe your horse threw you. Your arm is broken. There's a deep gash in your leg, and you're bleeding. Allah, who do you turn to? The town doctor, of course. But this isn't the clean, sterile world of modern medicine we know. Welcome to the grisly, gut-wrenching, and downright terrifying reality of medicine in the American Old West. When we think of the Wild West, we imagine gunfights, dusty towns, and heroic sheriffs. But we often overlook one of the most dangerous aspects of life back then: getting sick or injured. The local doctor was often a figure of both hope and dread. Why? Because a visit to the doctor could be just as deadly as the ailment that brought you there. So, who were these Old West doctors? Well, they were a mixed bag, to say the least. Some were highly educated physicians from the East Coast or Europe, who came west seeking adventure or fortune. They brought with them the latest medical knowledge of the time. But for every one of these qualified professionals, there were dozens of so-called doctors who had little to no formal training. Think about it. In the mid to late 19th century, there was very little regulation. Anyone could hang a shingle and call themselves a doctor. A barber, a blacksmith, even a snake oil salesman could decide to practice medicine. These individuals often learned their trade through a brief apprenticeship, or worse, just by reading a few medical books. Their understanding of the human body was, let's just say, creative. The result was a medical landscape filled with guesswork, superstition, and treatments that sound like something out of a horror movie. And at the heart of many of these treatments was the now infamous theory of the four humors. This ancient idea, dating back to the Greeks, proposed that the body was filled with four fluids: blood, phlegm, yellow bile, and black bile. Illness was thought to be caused by an imbalance of these humors. The cure, you guessed it, rebalanced them. And the most popular way to do that was through bloodletting. That's right. Draining a patient's blood was a go-to treatment for almost everything, from a fever to a broken bone. Doctors would use a small, sharp tool called the lancet to open a vein and let the blood flow into a bowl. The thinking was that by removing excess blood, you were removing the disease. In reality, they were often just weakening an already sick patient, sometimes fatally. And if a lancet wasn't available, no problem. They had another creepy-crawly solution: leeches. These little bloodsuckers would be placed on the patient's skin to do their work. While we now know that leech saliva contains an anticoagulant and has some legitimate medical uses, back then, it was just another messy and misunderstood method of bloodletting. Imagine lying in a makeshift clinic, sick and feverish, while the so-called doctor covers you in slimy, wriggling leeches. It's the stuff of nightmares. But bloodletting was just the beginning. Let's talk about surgery. Without modern anesthetics, surgery in the Old West was a brutal and agonizing experience. Patients were often just given a shot of whiskey or a stick to bite down on. Some lucky ones might get a dose of opium or a rag soaked in chloroform or ether, but these were crude and dangerous. The patient was usually held down by several strong assistants, while the doctor sawed, cut, and stitched. Speed was the surgeon's greatest asset. The faster they could amputate a leg, the less time the patient had to suffer and the lower the chance they'd die from shock on the table. Famous surgeons of the era were known for their lightning-fast amputations, sometimes completing one in under a minute. But this speed came at a cost. Accuracy was often sacrificed, leading to shattered bones and ragged wounds. And what about hygiene? Germ theory, the idea that invisible microorganisms cause disease, was only just beginning to gain traction in the late 19th century. Most Old West doctors had never heard of it, or simply didn't believe it. Surgical instruments were rarely cleaned between patients. A doctor might use the same scalpel to lance a boil, amputate a gangrenous limb, and then deliver a baby, maybe wiping it on his pants in between. They operated in dusty, non-sterile environments, wearing their everyday street clothes, often stained with the blood and grime of previous procedures. The result was, predictably, infection. Post-operative infections were so common they were almost expected. A condition known as hospital gangrene would frequently sweep through surgical wards, turning minor wounds into death sentences. Without antibiotics, a simple infection could quickly lead to sepsis and a painful death. It's estimated that the mortality rate for major surgeries like amputations, could be as high as 50% or more. You had a cornflip's chance of surviving the cure. And what about medicine? The doctor's black bag was a treasure trove of questionable remedies. It was filled with powerful, often toxic substances. Mercury, a potent neurotoxin, was a common ingredient in a popular laxative called calomel. It was used to purge the body of illness, but it often caused severe side effects like tooth loss, tremors, and organ damage. Arsenic and strychnine were also used in small doses as tonics. Opium and its derivatives, like laudanum and morphine, were the wonder drugs of the age. They were incredibly effective painkillers and were used for everything from coughs and diarrhea to women's troubles. The problem was, they were also highly addictive. Many people, including famous figures like Doc Holliday, developed severe addictions to these patent medicines, which were freely available without a prescription. And let's not forget the patent medicines sold by traveling salesmen. These were concoctions with dramatic names and even more dramatic claims. They promised to cure everything from cancer to baldness. In reality, their primary ingredients were usually alcohol, opium, or cocaine, designed to make the patient feel good temporarily without actually curing anything. They were the original feel-good scams. Even childbirth was fraught with peril. Without an understanding of germ theory, doctors often went directly from treating sick patients to delivering babies without washing their hands. This led to rampant cases of childbed fever, a deadly uterine infection that killed countless new mothers. It was a tragedy made all the more heartbreaking because it was so preventable. So, if you were a settler in the Old West, your best bet was to simply not get sick. Life was a constant battle against the elements, accidents, and diseases like cholera, typhoid, and smallpox. But if you did need medical attention, your fate was in the hands of a system that was often more art than science, more butchery than medicine. The image of the Old West doctor is a stark reminder of how far medicine has come. We owe an immense debt to the scientific pioneers who fought against superstition and ignorance to give us the safe, effective healthcare we have today. The next time you visit a doctor's office, take a moment to appreciate the clean instruments, the sterile environment, and the knowledge that your doctor isn't going to prescribe a dose of mercury or a good old-fashioned blood lake. The stories of Old West medicine are horrifying, but they are also a testament to the resilience of the human spirit. People endured unimaginable pain and faced incredible odds, all in the hope of seeing another sunrise over the vast, unforgiving landscape of the American West. It was a world of blood, guts, and leeches, and we're very, very lucky to be living on this side of it. Thanks so much for watching. What part of Old West medicine do you find the most terrifying? Let me know in the comments below. If you enjoyed this journey into the grisly past, don't forget to hit that like button, subscribe to the channel, and ring the bell so you don't miss our next video. See you next time.